Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Question: A 40-year-old female was given general anesthesia for abdominal surgery, during which she was understanding that she is going through and has a very uncomfortable feeling because she is knowing what is happening in the surgery. So she has very uncomfortable feeling about that. After surgery, she complained that she is able to recall all intraoperative events and it is very uncomfortable. Anesthesiologist apologized for the same. Now, the intraoperative awareness could have been evaluated and thus avoided if during the anesthesia the patient would have monitored which of the following. So, the question is which is used for monitoring the intraoperative awareness. Intraoperative awareness is monitored by bispectral index. According to uh, this bispectral index will monitor intraoperative anesthesia. If it is 40 to 60, then it means it is adequate. It is adequate for the surgery. Okay.
thank you and thank you for watching.